Hello and welcome to this week's Croí Connects. So this is a special World Heart Day special that we're bringing to you today. So World Heart Day is an initiative by the World Heart Federation, and the goal is to raise awareness about heart disease and stroke, which is still the world's leading cause of death. Today, I'm delighted to be joined by a panel of healthcare professionals, which include Dr. Jim Crowley, Consultant Cardiologist and Research and Medical Director of Croí and President of the Irish Cardiac Society, Aisling Harris, Cardiac and Weight Management Dietitian with Croí, and Dr. Jenni Jones, Physiotherapist and Senior Lecturer at NUI Galway. You're all very welcome. As part of our discussion today, we're going to discuss this year's theme, Use Heart, which centres on the actions that people can take to prevent and control cardiovascular disease. As always, we've invited questions from you, the public, which we hope to address over the next 30 minutes or so. So to begin, I'd like to start with you, Jim. How big a problem is heart disease and stroke in Ireland?
Irene, thanks very much for inviting me. Yes, heart disease and stroke is one of the biggest problems in Ireland. There are three major causes of death in Ireland today: cardiovascular disease, lung disease and cancer. And cardiovascular disease, which is principally heart attacks and stroke, continue to be one of the major causes of death. About a third of all deaths in Ireland are due to cardiovascular disease.
And Jim, how do you think we need to tackle this?
Well, there are several strategies, and there have been for many years. I suppose we see a lot of patients at the wrong end of the disease, if you like. These are the patients who present to hospital with an emergency, such as a heart attack or a stroke. And unfortunately, for a number of these individuals, intervention comes too late. We do have emergency interventional measures such as angioplasty, bypass surgery, and other drug therapies that we give at that stage. But and it's very important, of course, to be able to deliver all of this. But what we really want to do is to try and prevent the disease happening in the first place. Now, unfortunately, for many patients who come in who die of heart attacks, they die actually before they arrive in hospital at all, because they develop rhythm disturbances, and it is very difficult to save these individuals, obviously, because they don't make it to hospital. But if we were able to modify the course of the disease before it got to that point, then of course we could make a significant impact and improve mortality. And that's where we talk about drug therapies initially for managing risk factors, but even before that stage, looking at lifestyle measures and trying to modify risk factors, the so-called risk factors that we talk about, that we know increase the risk of developing coronary artery disease and stroke.
And of course, Jim, one of the themes of this year's campaign is Use Heart to make healthier choices. But how much of a difference does lifestyle really make? And perhaps I could go to you, both you, Aisling and Jenni, to talk about this. So Aisling, could you comment from maybe a dietary perspective?
So diet in particular can have a significant impact. For one, you're not just working on one thing, you're lowering your cholesterol, lowering your blood pressure, working on your blood glucose, your weight, your mobility, improving your fitness, improving your mood. So diet plays a big role in all those risk factors. Combined, you can work on all of them. So, you know, you can have reductions in your cholesterol, maybe 6 to 10% by diet alone. And then with the Mediterranean diet, it's a kind of a scoring system for your overall diet quality. So we know that a 1.5 point increase can reduce your risk of cardiovascular disease by 30%. So there's lots of scope for improving your risk factors via diet.
So that's really powerful information, Aisling, for the public to be aware of. And you know, up to 90% of heart disease and stroke is preventable. Jenni, from an exercise perspective, could you comment?
I would totally support what Aisling has raised there in terms of lifestyle, and diet is cornerstone. I think diet is really, really important. And moving is important. The two together are much more powerful than either on their own. So the combination of healthy eating or having a cardioprotective diet in combination with limited sitting time, moving as much as you can, keeping as fit as possible, I think the data would show us that largely heart attack and stroke is controllable through, we have a lot of control, and it's really just about prioritizing and knowing what the right things to do are.
And I think that's very empowering for people to be aware of, is, you know, how much control we do have. And I think you mentioned this, Aisling, when you make one change to your diet, that it impacts on lots of aspects of our overall health and well-being. So we're talking about obviously heart and disease and stroke today, but obviously these lifestyle changes are important for many chronic diseases as well. So I'm going to move on because we got lots of questions from the public, and I might direct the first one to you, Jim. So I'm in my 30s and I have high cholesterol. My dad had a heart attack in his early 50s. Should I be concerned?
Well, I think this is an excellent question, because it really brings up the whole area of lifestyle modification and the risk and the way we approach management of patients who potentially could go down the road of developing heart disease. What we're interested in is looking at all of the risk factors, not just whether their cholesterol is elevated, but also whether they have, say, hypertension, if they smoke, what's their level of exercise, what are their dietary habits. Because we know all of these things together increase the risk, multiply the risk of developing heart disease. So this patient, or this person, has high cholesterol, which is a modifiable risk factor, and he also has a family history, which is a non-modifiable risk factor. So it does depend, of course, on the level of cholesterol. But in the first instance, if the level of cholesterol is exceedingly high, then he probably does need direct therapy for that. But initially, it would be looking at the lifestyle changes that could actually improve his cholesterol levels. But also, it's not just enough to look at the cholesterol. A patient or a person like that who has no symptoms, it would be important for him to make sure that his blood pressure is checked and that he gets a fundamental idea of what his dietary habits are and what exercise levels he should be doing. And when you put all of that together, he might find that his blood pressure is elevated even though he's asymptomatic, and therefore his risk of heart disease is significantly increased because he now has another risk factor that he wasn't aware of. So the first instance, of course, he should get checked out. He should be seen, he should be evaluated. He should have his blood pressure checked, his cholesterol already checked, and he should have an assessment of his dietary habits and also his exercise levels. And once we have the full package of risk, then we can determine what his overall risk for heart disease is and how important it is then to attack each of the risk factors.
And of course, that ties in with a really important message about people knowing their numbers and knowing what their risk factors are. And Jim, is there a particular age that you would recommend for people, you know, to maybe talk to their GP about their risk factors? So for example, are there any guidelines that would say, you know, what age it's recommended to have your cholesterol checked and blood pressure? Because that's something that people commonly ask as well.
Yeah. Well, I think it also depends on a couple of different factors. For example, if there's an extremely strong family history of heart disease at a relatively young age, then patients in their 20s should make sure that they're getting their cholesterol checked, and they should also be looking for other risk factors. But if they don't have very strong family histories, then they probably, when they're getting into their 30s, they should be looking at getting things checked. Certainly, establishing a baseline is a very important thing to do. And after that, depending on what you find, then that might color how frequently things need to be measured. But it's never too young to start looking at diet and exercise, because if these areas are started at a young age, then habits can be engendered that will have an effect in the long run. And you know, the earlier you know, if you keep fit and you attend to dietary habits earlier on in life, it's likely that these will persist later on and they will have a bigger impact as you get older.
Great. So the next question follows on really nicely from that. So my doctor wants me to start medication to lower my cholesterol, but I want to try diet and exercise first. Will these help? Jenny, could I go to you on that one first?
You can. So in terms of cholesterol specifically, exercise can help. We know that doing the right type of activity and the right amount of activity can help the good levels of cholesterol. So the type of cholesterol that actually helps to protect. Remember, there's good and bad types of lipids. But probably in terms of Aisling, she'll add to this that the dietary factors are critically important. They're the cornerstone, really. And the exercise and helping to lose weight. So exercise is part of weight management. It's the actual losing weight that really helps with your cholesterol as well. So before I hand to Aisling, just to also highlight that we're seeing that sitting, lots of sitting has a very negative effect on your cholesterol as well. So the simplest things actually, by not sitting for too long, standing up regularly, these all have an impact on cholesterol, but also many of your other risk factors that are related to cardiovascular disease and lots of other health conditions.
Very good, Jenny. Aisling.
Yeah, and again, obviously diet can play a major role in lowering cholesterol. So one of the main things that would impact on cholesterol, especially your LDL cholesterol, would be things like saturated fat, and that would be foods like butter, cheese, red meat, processed meats, takeaway foods, pastries, all the really tasty things. So the first thing would be looking at those and how much of those we have in our diet. Obviously, if your doctor is suggesting a statin, they have a reason for it. So, it's always linking in with them, maybe having a trial period for if you're changing your diet, maybe giving it maybe 3 months, and then going back to your doctor and seeing what the change is. And if you've made a significant change through diet and they're happy, there might not be a need for statin, but I wouldn't rule them out either, because the impact that diet can have could be maybe 6 to 10%, then exercise can add more on, but it wouldn't be the same effect that a statin would have. So it really depends on the person, what your levels are, and what your other risk factors are, like Jim said. So diet can make an impact, but it's looking at the whole picture as well.
Yeah, one point, what I often find is that it amazes me how, in one sense, how little exercise is needed. Jenny, you might want to comment on that. We don't advocate weightlifting or running marathons or anything like that. It's only a modest amount of exercise, effectively, if you can build it into your lifestyle, that has a significant impact.
Yeah, no, absolutely. You're absolutely right. And we see the biggest impact actually in people who are quite inactive taking up a little bit of activity. So even if you don't meet the actual guidelines, if you start moving and you move more and you sit less, we see an immediate impact. And I think the key is to build up gradually. I think sometimes people think they've got to do a lot.
Yeah.
And then they can sometimes fail, because I've done it myself. You think I'm going to get fit, and you take on a huge challenge which your body's not ready for. So I think the art is moving more, building up, and it's a bit like driving a car. You gear it up, as you're doing more and you're starting to enjoy it, you gear it up more, but realize the effects and the benefits are immediate, even small amounts.
Yeah, I'd agree. I mean, a lot of patients come in and they're a bit daunted by the fact that they're being told that they, have to exercise more, that they have to be very strict about their diet. But in reality, it's about taking small amounts of exercise or modest amounts of exercise on a regular basis. And if they realize that, even taking small amounts of exercise, there will be a very significant impact. It's often, not the big hill that has to be climbed. It's just, get out there and do a bit of walking,
And just following on from that, Aisling, are there, I suppose, when you look at other ways of reducing cholesterol, have you any thoughts on the role of food supplements in reducing cholesterol? So I know often here in the Heart and Stroke Centre, people often ask about, using things like red yeast or, the yogurts or the spreads that are on the market. How beneficial are those?
So some of them can be quite beneficial. So like the little cholesterol lowering drinks can be quite good. So you would need to take one of them every day, sort of like a medicine. They can potentially reduce your cholesterol by about 10%. So obviously, if you were told you have high cholesterol, you can trial them for 3 months and then get your cholesterol checked again and see if they worked for you. They can be quite effective. The spreads and the milks aren't as effective. You would have to take a lot more of them. So you would have to use a lot more spread or milk rather than just taking the one drink. With the red rice yeast extract, there's not as much evidence there. They're not as highly quality controlled as, say, your statins or your drugs would be. So we're not fully sure how effective they are, and maybe the regulations around them aren't as strict. So we wouldn't always recommend them, but definitely people could try the cholesterol lowering drinks if they wanted an extra supplement.
Thanks, Aisling. Going back to the exercise piece again, Jenny, we had a query in from Nora, who's 64 years of age, and she's actually one of our Croí volunteers. So she says she doesn't like exercising too hard. She's always aware of her heart beating fast and feeling out of breath. And she's concerned that something might happen to her while she's exercised. So she just goes for light walks. Is that enough?
So I would say to Nora, it's an excellent question. I think, you know, it's a view shared. I often get asked, especially by people as well who've had a heart attack, for example, or who've had some heart surgery. They get very mindful of if their breathing gets deeper or faster, is that okay, or is it a warning? And I think the key piece of advice is that light activity is very safe. So absolutely, Nora, carry on with light activity, and that's fantastic. Upping the intensity just a little bit will give you additional benefit, because remember that the heart is a muscle, and just like, you know, a muscle in your arms or your legs, if you do the right amount of training, if you just stimulate it a little bit, you actually help to develop the muscle and protect against heart disease, stroke, and so on. And for the safety piece, if you can speak a whole sentence and you can speak it comfortably, but you notice your breathing is a little bit deeper and faster, you've actually got the icing on the cake then. So rather than just keep it light, be confident to go that little bit more, but always be able to speak that sentence, and then you know it's safe. I don't know if that answers that, Sharon. I would say keep moving, Nora, definitely. But there's no harm probably doing just a little bit more, and be confident to do a little bit more. It's a muscle. It responds to the exercise.
No, that's great, Jenny. And I think that's very sound advice, and hopefully very reassuring for Nora and many others, I'm sure, you know, who often can be concerned about pushing it that little bit more, that we have to trust our heart, because it, as you say, it is a muscle and it is strong. We're going to move on now to just the topic of blood pressure. And this was a question again that came in, and it was from a gentleman. So he's 73. And he was recently told that his blood pressure is high, and by high, 170 over 105 millimeters of mercury. And his query is this not normal for my age? Jim, could I ask you to respond to that one?
Yeah, well, it's not normal for his age. It's too high. And again, when we look at risk factors, again, we try and group them all together, as I was saying before, and try to come up with an estimate of what the patient's risk is. But also individual risk factors, when they get way out of control, and a level of 170 over 105 would be considered to be very significantly elevated. In and of themselves, they are a particular risk to the patient, particularly of getting a stroke. So somebody, even at the age of 75, would be recommended to adopt measures to try and reduce that. And probably at that level, he will require drug therapy. So again, you know, we talk about the group of risk factors, but again, if blood pressures by itself are particularly high, then that by itself, regardless of his other risk factors, gives a significant risk of getting a stroke in particular, as well as increasing the risk of of heart attacks. So yes, yeah, he needs treatment.
Okay, Jim, great. And of course, I'm sure lifestyle has a role to play here as well.
Oh, yeah.
Aisling, could I briefly ask you any tips from a dietary perspective that impact on blood pressure?
Mm-hmm. So the main thing that would affect blood pressure would be salt and sodium. And interestingly, 80% of the salt that we eat is already in our food before we ever even add at the table. So if you're adding salt to the table, that's the first thing to look at. And then look at salt in foods that you mightn't even think of: cheese, biscuits, breads, cereals, all these foods. And obviously the high salt things like your crisps and your crackers with salt in them, takeaways. We need about 5 grams of salt a day, but in Ireland the average intake is about 9 to 12 grams per day, so over double what we have. One takeaway could be 9 grams of salt in a single takeaway before you've had any other meals. So salt's the big one. It's in a lot more foods than we think, so definitely look at your food labels and get to know what foods are high in salt.
Wow, Aisling, that's staggering.
Yes.
Okay, so the next question, Jenny, is for you. I recently had 2 stents inserted and I've never felt better. My doctor recommended I do a rehabilitation program, but I don't see the need as the problem has been fixed. And this is from Joe in Ballinasloe. Jenni, I know you're past president of the British Association of Cardiac Rehabilitation, so it would be great to get your thoughts on this.
I would suggest differently. While you have the stents, I think the underlying condition is coronary heart disease, and unless those risk factors are fully controlled as optimally as possible, I mean, that is the key, and that's where a prevention and rehabilitation program comes in. So I would strongly urge people to take the opportunity. Even though you may feel great, it's making sure that you're under that professional care to really make sure that you're optimized for the future, because as we've said, so much is preventable, and it's about the things you don't feel. It's about your blood pressure, your cholesterol, and that's what a comprehensive prevention and rehabilitation program addresses. I think the issue is because it's called rehabilitation, sometimes it gives a perception that it's all about something physical, and if we are up and moving and we're feeling okay, but actually it's a lot more than that. It's about the art of the science behind really controlling coronary heart disease and making the most of prevention under specialists, people who know what they're doing. So I would say, you know, take it up. The evidence is the highest quality evidence of benefit.
Sure. So it's really about, you know, this is something positive. It's about prevention for the future as well. The next question came through on our HeartLink West telephone support service. I have recently been experiencing some indigestion more than normal, and when I walk up a hill I sometimes get breathless. Should I be concerned? I really don't want to bother my GP, as I know they're so busy with the pandemic at the moment. Jim, I might ask you to respond to this one.
Yeah, this is very topical at the moment. What we have found is that the number of people presenting to hospital with heart conditions has fallen dramatically, not just in Ireland, but across Europe. And there are a number of reasons for this, but one of them is that patients don't really, seem to be afraid to come into hospital or even to go to their GP to get an assessment. And this is absolutely the wrong thing to do. The problem is that with a lot of heart conditions and patients presenting with heart attacks, the symptoms may not be severe, and they may not even be easy to recognize. So if you are feeling unwell and if you are having problems, you need to present to your GP. That's what the GP is for, and the GPs want you to present to them. And if necessary, and you're feeling really unwell, you may have to go directly to the hospital. I think in the COVID era, there was concerns that patients would be at high risk of getting COVID by going to the hospital. But in fact, all of the hospitals have pathways for treating patients who have the possibility of having COVID, and also patients who clearly do not have COVID. So there are separate pathways into the hospitals for managing patients with and without the condition. So it's really important that patients who think they may have a problem, that they go to their GP or go to a hospital. This patient, to me, if a patient presents with these kind of symptoms to me, I would suspect that they have a very high probability of coronary artery disease and potentially would be at risk of a significant heart attack. Their symptoms are very, very suggestive of heart disease. Now, they may think that it's heartburn or related to the stomach and other things, and they may well be right, because sometimes it's impossible to know the difference between the two. And and so we have to assume that the patient has the worst and treat them from there, and then find out if they have a problem. But the big thing is go and get seen. Don't sit around guessing. You can't guess. It's too important not to guess.
And I suppose I should add to that now, Jim, that this person did receive that advice, has been to their GP, and is actually getting the appropriate care. So, which is great. So it's a positive story. But I felt it was an important query to share with the public, and there's an important message here, because, you know, one of the unintended consequences of COVID-19 is that people have been staying at home because they've been listening to the public health messaging around, you know, stay at home. But staying at home does not apply to people who feel that maybe they may be having a cardiac event or maybe having a stroke. That's the important message here.
Absolutely. I mean, if you're feeling unwell, you should still go to your doctor. I mean, you should not be avoiding the doctor for fear that you're going to get something in the doctor's office or get something in the hospital, because you may well be missing out on another illness that is equally important or far more important than COVID for you as a patient. So absolutely go to your doctor or go to the hospital if you feel that unwell. You see, you can, it's so easy to underestimate heart disease. So easy. Symptoms may be very minimal. In many cases, patients come into the hospital and we don't know if they have heart disease for sure. They have symptoms that could be related to the stomach. They could be the very same symptoms in one patient may be due to a heart problem, a lung problem, a stomach problem. And it's only by doing investigations that we will know ourselves. So with the patient coming in the door, we may not be sure what he has or he or she has, but we have to go through the investigations. But we know there's something going on, and sometimes it might be serious. So I would definitely, if you feel unwell, contact somebody. Don't be guessing. You know.
Great, thanks, Jim. And just on the subject of COVID, because we're hearing a lot now in the media about the long-term effects of COVID-19 on the heart and the lungs, particularly in people maybe who didn't have any underlying cardiac conditions beforehand. Could you comment on that?
Well, we're learning all the time. It's a new disease. It's a new condition. It has some similarities to other viruses, but it has significant differences. The mortality rate associated with COVID is much higher than with other viruses such as the flu and so on. But cardiac effects seem to be one of the major causes of death in these patients. But there may also be long-term effects. They may cause damage to the heart muscle so that the heart muscle weakens and you can be left with what's called a cardiomyopathy, where the heart muscle doesn't squeeze as well as normally, and that you can be left with shortness of breath. There may be other conditions associated with it. I mean, many people make a full recovery. By far, the majority of people make a full recovery, but there can be residual effects that can last for a long time. We actually don't know how long these last. Unfortunately, in some people it may be permanent. You would expect that as time goes by with many of these patients with these cardiac conditions, that they would actually improve with time and with appropriate drug therapy. But patients may have a significant illness going on for a number of months after the condition before they begin to make a full recovery. So, you know, it's not the quick 2 weeks or the quick 6 weeks if you're in a hospital and really unwell. You know, there can be a significant period of illness beyond that where patients are not operating at full capacity.
Thanks, Jim. So during these times, obviously taking care of your heart is more important than ever before. And certainly heart disease and stroke are not going away. So we're drawing to the end of today's session, and perhaps to wrap up today, could I ask each of you maybe for your one key take-home message on World Heart Day today? Aisling, could I start with you?
Yeah. Well, I think mine would be know your numbers. So know what your cholesterol is, know what your blood pressure is, know what your blood sugars is, and your waist circumference, and monitor them over time. So know your numbers. Okay,
great. Thank you, Aisling. Jenni?
That's a really good one. So I can't say the same. So I'm going to say more standing up. The more I read and the more I understand, the more I see the effect that even if you're a very active person, if you do a lot of sitting, it actually has a negated effect. So we've seen, you know, some really strong data that says just stand up. So avoid sitting for long periods of time. And I think it's very relevant in COVID, you know, in our own household, stopping children watching prolonged amounts of television, even my own behavior with Zoom call after Zoom call, lots more computer work, and trying to stand up and be on a mobile phone standing up. So just keep standing. I think that would be my biggest message. An easy thing to do, and you don't even build a sweat, but there's loads of benefit.
Thank you, Jenni. Very, very practical advice that we can all take on board, I think. Jim?
I think it's very unfair being the third person in the list. Yes, I mean, I suppose you could say that during these COVID times, there's an air of anxiety in the country and across most individuals. And, you know, this certainly, when we start talking about the normal things to do and the things to do that are good for your health, they're probably good for a lot of things apart from heart disease, particularly the mood of the country. And, you know, there's a lot of anxiety. So I would say, you know, like you said it already, know your numbers. I think do exercise, watch your diet, But don't be obsessive. You don't have to be obsessive about this thing. This is about normal eating and exercise patterns rather than about abnormal eating and exercise patterns. It's about trying to do the normal things in a normal way. So I suppose keep the head up is the best advice I can give to most people during these times. So hopefully this won't last for too long more.
No, that's great, Jim. And I think it's important that we all stay positive and focus on the things that are in our control as well, you know, which is really important. So to close out today, I'd like to thank each of you for joining us as part of this special session. So to you, Jim, Jenny and Aisling, I know you're all very busy clinicians, frontline workers, so thank you very much. I'd also like to thank our audience at home for submitting your questions as always. And I think they've all been really comprehensively dealt with today. And of course, please do be aware that we do have our dedicated telephone helpline service, HeartLink West. So if you have any concerns or if any of the questions today have sparked anything, please do call us on 091 544 310. Croí Connects will return next month. In the meantime, don't forget to stay tuned to our website where there's lots of great resources, and follow us on social media. So thank you for watching, and goodbye.